It's a moment that pretty much every dog owner goes through. You're petting your best friend, just enjoying the moment, and then your fingers find it, a new lump that you swear wasn't there yesterday. So in this explainer, we're going to turn that moment of worry into some informed action and hopefully give you some real peace of mind.
Yeah, your heart just kind of sinks a little, doesn't it? But take a breath. It is completely natural for your mind to jump to the absolute worst-case scenario. So before we go any further, let's get some clarity on what might actually be going on under their skin.
All right, so every lump or bump really falls into one of two main categories, and understanding this basic difference is the most important first step in figuring out what we're looking at.
Okay, so on one side you have benign lumps. I want you to think of these as, well, quiet neighbors. They might be there, but they pretty much keep to themselves and don't cause trouble for the rest of the neighborhood. Now, on the other side are malignant lumps. These are the cancerous ones. They're more like unruly neighbors that can invade the surrounding area and sometimes even spread to other parts of the body. Here's the most crucial point, though. You absolutely cannot tell them apart just by looking or feeling.
And here is the first piece of really good news, and I want this to sink in. Seriously, take a deep breath. As you can see right here, fewer than half of all lumps found on dogs are actually malignant. The odds are already on your side that whatever you found is benign.
So let's meet a few of these quiet neighbors. Lipomas. These are just fatty tumors, and they are incredibly common, especially in older or, slightly pudgy dogs. They're usually soft and kind of squishy. Then you've got Histiocytomas. We often call these button tumors. They tend to pop up on young dogs, but the amazing thing is they often just disappear all on their own. And papillomas, they're just doggy warts, and you'll often see them around the mouths of puppies. Honestly, many of these are just a normal part of a dog's life.
So knowing all this, we can shift from a place of just passively worrying to one of active, empowered observation. You are the first line of defense. You're the most important partner in your dog's health.
Try to make this a regular part of your routine. Maybe once a week during a cuddle session, just intentionally run your hands everywhere. Think of it as a massage with a purpose. Start at their head and work your way all the way back, checking their ears, their body, their legs, and even between their toes. And always, always end with lots of praise and a favorite treat to make it a great experience for both of you.
Now, if you do find a lump, this log becomes your single most helpful tool. Seriously, becoming a little bit of a detective at home makes you an invaluable partner when you come to the vet clinic. So grab a ruler, maybe even snap a quick photo with your phone. Note down its color, its texture, and if it moves around under the skin. This kind of detailed timeline is just incredibly helpful. It gives us the full story.
Now, while most lumps can be monitored, there are some definite red flags that mean you should call your vet sooner rather than later. If a lump is growing quickly, if it looks red or swollen, has any kind of discharge, or just seems to be bothering your dog, it's absolutely time to make that appointment.
Okay, so you've made the call. A vet visit doesn't have to be a source of anxiety. Let's pull back the curtain a little bit and demystify exactly what happens when you bring your dog in for a lump check.
This is the million-dollar question, isn't it? How do we go from some mysterious bump to a clear-cut diagnosis? Well, it's a systematic process, and it's designed to get us answers safely and effectively.
First off, we'll start with a really thorough physical exam, and we'll use those excellent notes from your monitoring log. Then the most common next step is something called a fine needle aspirate, or an FNA. I know that sounds super technical, but it's a very simple and quick procedure. We just use a tiny needle, honestly no bigger than what's used for a vaccine, to collect a small sample of cells so we can get a closer look. For most dogs, it's over in seconds. Now, if that test isn't conclusive, we might talk about a biopsy, which just means sending a small piece of the tissue to a lab for the final definitive diagnosis.
Now, I really want to pause on this because it's one of the most important pieces of advice I can possibly give you. Please, please do not try to squeeze or pop a lump on your dog. This can cause some serious pain, it can lead to a nasty infection, and in the case of a malignant lump, you could actually risk spreading those cancerous cells. Just leave it to us professionals.
So, let's just briefly touch on the unruly neighbors. Again, the point here is not to frighten you, but to really reinforce why getting a proper diagnosis is so vital. Mast cell tumors are the most common ones we see, and they can famously grow and then shrink again, which can be confusing. Squamous cell carcinomas, those can be linked to sun exposure, especially in light-colored dogs. And malignant melanomas, they can hide in tricky spots, like on the lips or even in the nail beds.
Getting a diagnosis, even if it's a serious one, is not the end of the story. In fact, it's the beginning of a clear plan. It's that moment we move from the unknown to the known, and that is where hope truly begins.
And just look at this toolbox. For a lot of those benign lumps, we simply monitor them. For others, we have so many effective treatments, from a straightforward surgical removal to more advanced options like radiation, chemotherapy, and even specialized immunotherapy vaccines for certain cancers. The path we choose is always tailored specifically to the type of lump and, of course, to your dog's overall health.
So, the crucial point is this: hope is real. Modern veterinary medicine has made incredible strides. So many malignant tumors are very, very treatable. And the single biggest factor that influences a positive outcome is catching them early. If you take away just one single thing from this entire explainer, please let it be this. You, with your hands and your eyes and your love for your dog, you possess the most powerful tool there is: early detection. Those weekly checks aren't just for finding lumps, they are for finding them soon.
I'll leave you with this thought. The next time you're curled up on the couch with your companion, it's no longer just petting. It's a proactive check, it's a loving observation, and it's truly the most important thing you can do to help ensure a long and happy life together.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.